Hello and welcome. My name is Steve Riley. I'm a clinical support pharmacist with Medicines Optimisation. Within this webinar, we will be looking at the skincare category within the community pharmacy setting, and specifically around managing scarring and stretch marks. We will begin by considering the impact of scarring and stretch marks on patients. This is an area that can often be overlooked, but one that can have significant negative impacts on patient well-being. People who are worried about scarring can often be hesitant to raise their concerns with their doctor for fear of judgment or time wasting, and can often not seek help despite the impact it is having on their life. As pharmacists, we are often the first point of contact and can be a crucial touch point from which to offer intervention to patients through advice and recommendation. We will look at where pharmacists can fit in within the primary care mix with regards to scarring and stretch marks, and then move on to provide you with a base level overview of scars and stretch marks, and recommending tools and resources to further deepen your knowledge. We will finish this session with a look at how you can optimise your skincare category within your pharmacy in preparation for the autumn and winter seasons, which can see skin conditions worsen due to weather, amongst other exacerbating triggers. Although very common, scarring and stretch marks can have a pronounced psychological effect upon patients. A recent study of 1,000 patients on behalf of BioOil found that 39% reported that scars affect their daily life, experience feelings of depression and anxiety, and reported withdrawal from social activity. Almost two-thirds, around 62.4% of women, said that their scar has affected their body confidence. This is a significant proportion and can have a big societal impact and associated pressures. Some feel that they've been judged due to their scarring. 1 in 2 women suffer psychological issues due to stretch marks and scarring. Mums can often feel psychologically confused owing to the stretch marks caused by changes to their bodies during pregnancy. Just at the very moment mums should be feeling the joy of pregnancy, along come those unsightly stripes on their stomach as a result of their bodies accommodating their growing babies. This is a moment that many are dreading. Scars are often the result of a traumatic experience, yet in pregnancy, they're a sign of something momentous with a truly rewarding outcome. Mums-to-be are often psychologically confused by this, just when they need all their energy for an imminent birth and a complete lifestyle change. They can feel guilty about resenting the stretch marks that are developing. Later on down the line, when many have worked hard at getting their pre-baby figures back as much as possible, the stretch marks will remain, and this can significantly affect their body confidence. 1 in 10, or nearly 9% of people, reported feeling isolated as a result of their scar. If a mum's psychological needs aren't met as their stretch marks develop, and shortly after the birth, a feeling of isolation may set in. This isolation can take many forms. They feel less physically attractive to their partner, anxious or resentful if their stretch marks are more visible than other mums, or it may even put them off having more children. It may result in eating disorders during subsequent pregnancies in order to avoid further stretch marks. Without recognising the very real needs of mums with stretch marks and attending to those needs, women often lose a sense of genuine perspective towards their scars, and 1 in 10 not only feel social and emotional isolation, they also feel that their scar has become more visible than their true self. Emotional support and physical support are equally important. Many patients feel emotionally and psychologically unsupported. They feel that their concerns around scarring are viewed as trivial. While we will hear there's much can be done to help women reduce the physical appearance of their stretch marks, they are unlikely to ever completely disappear, so women need emotional reassurance about living with their stretch marks. They need to be encouraged to see them as something perfectly normal and part of the incredible process of pregnancy and birth. Unfortunately, with social media images galore, or celebrities showing their perfectly stretch mark free and often airbrushed images of their post-pregnancy tummies, concerns about body image are stronger than ever, and not everyone will see those marks as a beautiful reminder of their pregnancy experience. But this kind of reassurance from you, as well as support from family and friends, will help enormously in their journey of acceptance. During the process of managing scarring and developing a good scar, patients are advised to employ massage of the scar. Alongside the physiological benefits this can bring, it will also help them bond with their scar and promote acceptance. Understanding that there's a physiological element, psychological element to scarring and stretch marks is important, and patients need to be signposted for other medical interventions as required. So considering about how we fit in as pharmacists, scarring and stretch mark management are not an area that many pharmacists are well informed about. It is not an area extensively covered by our core education, and some would not readily associate it with the key activity of supporting the safe and effective supply and effective use of medicines. However, we are taking on and delivering more clinically focused roles. There is a need, particularly in the community setting, to support the self-care, health promotion and health well-being agenda. How confident would you be in identifying patients in need of support with scarring? Could you answer the questions such as, how do I manage my skin post-operation? How can I prevent or reduce stretch marks during pregnancy? Can I reduce the appearance of my scar? What causes scars or stretch marks? However, it is an important part of assisting patients with self-care and a condition which is manageable with over-the-counter products and an area which pharmacists can provide valuable support to patients. In a study conducted by BioWorld amongst UK pharmacists, 46% believed they were best placed out of all healthcare professionals to offer advice to people with scars and stretch marks. And the need is clearly demonstrated amongst patients. In a recent survey amongst 1,000 people with scars, 37%, over a third, said they would like verbal advice from a healthcare professional. 32% would like to receive advice on how their scar will change over time, and over a quarter would like a healthcare professional to proactively offer advice. It is helpful to know when to spot opportunities to intervene with patients in order to offer advice. Patients may not always be forthcoming in seeking such advice. For example, if you're dispensing wound care products and dressings, this is a prime opportunity to discuss aftercare and ensure the patient is well informed on the importance of caring for the wound and scar to ensure the best outcome. Another example could be a discussion with a patient about a pregnancy where they're expressing concerns about their body changing. You could intervene here by reassuring the patients and giving tips on hydration, diet and lifestyle, along with massaging an oil such as bio-oil into the skin to minimise and reduce the appearance of stretch marks. Now we consider the various scar types. There are different categories of scars and each will mature differently. There's atrophic, which are typically small, flat or depressed relative to the surrounding skin and often caused by acne or chickenpox. This is where collagen is destroyed within the dermis where the cysts occurred. Skin can be drier and less elastic. Hypertrophic, these are raised above the surface of the skin and red, but they do not exceed the boundaries of the original wound site. They can continue to thicken for up to 6 months and can be very itchy or painful. There's keloid scars. They grow beyond the boundary of the original wound site and are due to an imbalance of the production of collagen protein. Scar contractures. This is when scars cross joints and can often be the result of burn injuries, and they may affect movement. Following stretch marks, stria. These result in the skin suddenly stretching. The dermis breaks in places, allowing the deeper layers to show through. This often occurs in a period of rapid weight gain. 8 out of 10 women get stretch marks during pregnancy. 7 out of 10 girls and 4 out of 10 boys will get them during puberty. Risk factors can include a higher BMI, age, and race. It can take up to 2 years to see the scar at its best, so patients can be reassured in most cases the scar will continue to improve. Skin type is an important factor. Darker skin types, particularly Afro-Caribbean or Asian, are susceptible to keloid scarring, where there is an overgrowth of the dense fibrous tissue outside of the boundary of the wound. Fair or freckled skin types will tend to produce more noticeable scars than others. The age of scar is a factor. Young scars, typically less than 6 to 9 months since the wound healed, will present red and possibly raised. Young scars are still maturing, so it's important to reassure the patient that the colour will fade over time. Typically, older scars will appear faded and pale. The age of the patient is also a factor. Both keloid and hypertrophic scarring are more common in younger patients with darker skin, typically people between the ages of 10 and 30 years old. Now, if we consider the scar healing and maturation processes, this comprises of several overlapping phases. First, we have hemostasis and inflammation. This is where the blood will rush to the site of the wound to form clots. Cells in the blood will release chemicals which will then cleanse and prepare the wound for healing. This will typically take up to 7 days. Next, we have the proliferation phase. Collagen and ground substances, which are the bricks and mortar of a scar, are laid down. New capillaries are formed and the outer layer of the skin is healed. This process will take up to 2 weeks. Finally, we have the maturation and remodeling phase. Collagen continues to build and fill the area, creating the scar. The scar then covers and protects the site of the wound, though it can be easily disrupted. Overall, the maturation and remodeling process will take up to 2 years. It's important to consider that the resulting scar tissue will often never attain the appearance or strength of surrounding skin, and hair follicles or sweat glands at the scar site will never grow back. Now we consider managing scars in primary care. The BioRoyal professional website houses a wealth of information and resources about scarring and stretch marks that can be accessed by healthcare professionals. You can even sign up for an email newsletter to get new information shared with you on an ongoing basis. One of the resources featured on the website that I would strongly recommend is the free e-learning module, Managing Scarring in Primary Care. This has been authored by a dermatology nurse specialist. The training offers 4 phases and covers key topics, which include how scars are formed, the psychological impact of scarring, new and emerging treatment options, and how to raise the subject of scarring with patients and have discussions. Upon completion of the training module, you will receive a free e-certificate to demonstrate the learning that you've undertaken. This can support you with your professional development. There's also another great resource, the Aftercare pack. This was authored by dermatology experts and a behavioural psychologist. The resource provides very useful information for healthcare professionals to use during consultations with patients. 4 key areas are covered within the educational booklet: the psychological impact of scarring, the physiology of scars, including the different scar types, the healing and maturation processes, practical tips on how scars can be minimised, guidance and resources for discussing scarring with patients. The resources within the pack include SCAR, which stands for Site and Skin Type, Category, Age, Reassure and Recommend. It is a quick reference guide to help support managing patients with scarring and focuses on encouraging discussions between patients and healthcare professionals. It provides structured and key discussion points to aid and support the conversation. There's also CARE, which stands for Connect and Contact, Application, Regular and Expectation. This is a guide and a very useful tool which can be given to patients to take away to ensure they get reiterated key messages and they know how to care for their scars. Bio-oil samples are also available to share with patients for use. So thinking about what patients are looking for and providing patient advice, scar and stretch mark advice should go hand in hand with a number of commonly presented skin ailments and natural processes that cause changes to the skin. For example, cuts, burns, surgical procedures and pregnancy, which are all areas as pharmacists we commonly are asked to advise upon. Factors such as bleeding, infection, the wound opening up and even smoking can delay the healing process in the case of scarring. However, there are measures patients can be advised to take to minimise these risks. If the scar isn't healing, particularly if it's red, itchy and becoming more pronounced, patients should be advised to see their doctor or GP. It may be that the scar is being overactive and topical treatments may be required to reduce this activity and support the healing. There are currently some treatments that do help reduce scarring, such as skin needling, corticosteroid injections, lasers and dermal fillers. You could advise your patient to seek specialist advice and discuss these treatments. For post-healing measures, there are several steps patients can take. Massage an oil or moisturiser into the skin twice daily to keep the scar hydrated and soften the scar tissue. You can apply silicone gels or sheets to the scar. Wear a sun cream. Sun exposure on new scars can cause pigmentation that can take time to settle. If desired by the patient, a trained camouflage practitioner could be consulted to discuss camouflage options accessible through charities such as Changing Faces, and in certain cases can be a great support to patients. For the winter months, massaging an oil can also be beneficial to help combat dehydrated skin in general. Now we consider maximising your skincare category. The skincare market is estimated to be worth £2 billion. It is a growing area for pharmacy and a key point for the self-care agenda. Patients frequently ask for advice around skincare and management of skin conditions. It can now be an area which generates the most inquiries after coughs and colds, especially in the winter season, which can see skin conditions worsen due to the weather, heating conditions and other exacerbating triggers. GPs often do not have the time to spend advising patients. As pharmacists, we are uniquely placed to provide that advice to patients and to support them to effectively manage their skincare conditions. With this in mind, a comprehensive skincare category is imperative in supporting patients and the way they perceive products. As well, it will also drive sales and profits within the pharmacy. This can be influenced through merchandising skincare treatments within the store according to the seasons. Building a comprehensive category includes advice as well as a good array of products. By developing a specific area of the pharmacy dedicated to skincare as a therapy area as opposed to just moisturisers per se. This could be seasonal. For example, in the summer, include products for itching, cooling, moisturising, sun lotions, and even treatment for insect bites, such as antihistamine, steroid creams, and oral preparations. For the winter, elements to support dry skin management are very useful too. To also have products as a constant, such as the likes of bio-oil for scars. Dual siting with areas such as mother and baby fixtures will help further engage those patients that hadn't previously considered certain products. Lastly, by having a dedicated section for all skincare, not only do patients know where to look, but this will also help identify people to approach to offer support to. It's important to support patients to find the right products. Very often, they will be self-managing their conditions and they may be embarrassed to ask for and seek advice, especially in the case of scars and stretch marks. Many products used in the skincare and to manage seasonal skin conditions, such as dry winter skin or exacerbations of other conditions, are displayed in various places within the pharmacy. Many items, such as emollients, creams, moisturising oils and bath additives, are general sales list items. In some cases, in such as supermarkets or larger retail stores, they can be some way from the pharmacy counter. Having a clearly themed display could really support patients to quickly find the products they need. Dual facing of certain products can be very helpful, or using dummy packs of medicines can also help identify patients to find products such as steroid creams to treat flare-ups of conditions like eczema and psoriasis. It's also very important to support patients with consistent advice and educational messages, and to utilise your whole pharmacy team. By taking the time to invest in the education and support of your support team, particularly the medicines counter assistants, this will help you ensure that you deliver consistent messages to support patients and positively impact upon a greater number of patients. Educational resources are available and often free. They're pitched at all members of the pharmacy team, and this can help pharmacy staff identify patients with skincare needs. This will also enable you to ensure all patients receive simple, key messages. Your merchandisers can sometimes support with educational materials. It is important to deliver and support patients with clear advice on managing skin conditions and preventing flare-ups. Advising patients effectively on the current NICE guidelines, areas such as complete emollient therapy, can support them to reduce exacerbations of conditions such as psoriasis and eczema. Consistent lifestyle advice, such as diet and smoking, are important too. Remember, when advising patients, sensitivity can be key, especially around the areas of scar and stretch mark management. Prevention advice is very important in supporting the self-care and health and well-being agenda. Important elements include to stay hydrated, drinking plenty of water, moderating intake of alcohol and caffeine, which act as diuretics. Take care on how you warm up your skin during the winter. Warming too quickly can be problematic. For example, if you have a very hot bath or place your hands in hot water. The type of clothing you wear is important, avoiding wet socks and gloves and using cotton gloves as opposed to wool. Home comforts such as central heating, which can dry out rooms, long hot baths or showers, scented bubble baths and soaps can strip oils from the skin. So try using a humidifier at home, taking warm baths as opposed to hot, and using simple soaps or those containing moisturiser. Moisturising is important, and also pat the skin dry afterwards with a towel as opposed to vigorously rubbing. Moisturise, 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 using emollients or products such as bio oil. Take care with winter sun, especially if you travel abroad, and ensure you use effective sunscreen. This advice can be effectively delivered by medicine counter assistants and support staff. Education materials that patients can take away can also be really helpful and reinforce key messages. They are available from the NHS, manufacturers and other sources. Tools such as the Bio-Oil Care Guide, which we previously discussed, can be really useful in supporting patients. Just really finally thinking about bio-oil as a product. It's a specialist treatment for scars, stretch marks, uneven skin tone, aging and dehydrated skin. It's suitable for all skin types and tested for sensitive skin. It's underpinned by clinical research. It's also Skin Health Alliance approved. It's available in pharmacies nationwide. And the dry oil formula rapidly absorbed into the skin without leaving a greasy residue. In summary, it's able to treat scars and stretch marks. It can support the skin during pregnancy and periods of rapid growth to help maximise skin elasticity and reduce the formation of stretch marks. It helps improve the appearance of scarring, new and old, and helps maintain the elasticity of scar tissue on joints and other high mobility areas. It's useful to hydrate the skin and helps improve skin comfort and appearance. But it's very important to note, no treatment can completely eradicate scarring and stretch marks. It is vital to manage the patient's expectations about what results they expect to receive by using any such treatment. So finally, I'd like to thank you for taking part in this webinar today. I'd just like to leave you some further resources and reading. So we've got the Managing Scarring and Primary Care module, the Aftercare pack. I would recommend you sign up for the BioWell Professional newsletter to receive the latest training, resources and industry news.